Okay. Okay.
Yeah. Good morning, friends. I'm Dr. Shilpa Gandhi, and I'm a consultant thoracic surgeon specializing in keyhole and robotic thoracic surgery. I work at KIMS-Kingsway hospitals, Nagpur. So today, our topic of discussion is facts and myths about surgery and lung cancer. Uh, Very common topic, but very confusing topic. जब पेशेंट्स आते हैं मेरे पास, तो सबसे पहला सवाल और कंफ्यूजन के दिमाग में ये रहता है कि क्या सर्जरी फीजिबल है, क्या सर्जरी पॉसिबल है लंग कैंसर के लिए. And the first thing I say is, depending upon the stage at which it appears and the patient presents to us, yes, in the initial stages, surgery is the definitive treatment. मतलब सर्जरी करेक्टिव ट्रीटमेंट है लंग कैंसर के लिए. सर्जरी से एक्चुअली जो 5 year सर्वाइवल हम जो देखते हैं, 5 year सर्वाइवल वो प्रोलॉन्ग होता है. सर्जरी इज क्योरेटिव if we choose the right patient, and if again it depends upon the staging of the patient at the presentation. The second most common question people ask is, doctor, why surgery? We want injections, we want just, can we not take just tablets, or can we not just go ahead with the injection therapy, which we call it as like chemotherapy. I said yes. मैं हमेशा उनको यही बोलती हूँ कि yes, you can, if it's out of the operable stage, or if the patient is not fit. So depending upon the presentation of the lung cancer patients in our clinic, अगर पेशेंट लेट स्टेज में प्रेजेंट करता है ना, या पेशेंट अनफिट है, तो हम उनको रेकमेंड करते हैं कीमोथेरेपी या इम्यूनोथेरेपी या रेडिएशन थेरेपी, अगर प्रोवाइडेड उनमें वो मार्कर्स प्रेजेंट है ना. Hence that's what I say. लेकिन मैं ये नहीं कहूँगी कि ये फर्स्ट लाइन ऑफ ट्रीटमेंट है. फर्स्ट लाइन ऑफ ट्रीटमेंट इन द अर्ली स्टेज does remain operations or lung cancer surgeries. Like I said, again, the third most common question is, doctor, we are really scared of going under the knife. You know, we just हमको सिर्फ tablets चाहिए. हम we are happy with the tablets, है ना. We are very हमें सर्जरी से डर लगता है. हमने सुना है कि ये क्वालिटी ऑफ लाइफ को अफेक्ट करता है. So I will say, well, I specialize in keyhole thoracic surgery, and जिसमें हम सिर्फ 2 सेंटीमीटर का कट लगा के दूरबीन द्वारा पूरी सर्जरी करते हैं. इसके बहुत सारे फायदे हैं. सबसे पहले तो अर्ली रिकवरी फ्रॉम द सर्जरी. मरीज जो है सर्जरी के बाद 3 घंटे बाद ही इज आउट ऑफ बेड, ही इज मोबिलाइजिंग. मतलब he starts drinking, and then he starts eating appropriately from the day of the surgery itself. हॉस्पिटल का उसका स्टे कम रहता है. आईसीयू में जाने के चांसेस ऑलमोस्ट नील. Yeah, there are a lot of benefits. Pain सबसे इम्पोर्टेंट क्वेरी या डर रहता है मरीजों का कि सर्जरी होगी, बहुत बड़ा कट लगेगा, और it will be an extremely painful stay or painful period after that, with a prolonged recovery. So keyhole thoracic surgery या keyhole surgery का सबसे बड़ा benefit है कि पेन कम रहता है, and recovery is very fast. Most of these patients, third day or maximum fourth day, they go home. So I had a patient, and he was like 52-year-old, and with an early stage, at the time of presentation, it was an early stage lung cancer. And the first question he had, or the first query he had in his head was, at this age, Madam रहने दीजिए, at this age, I don't want to undergo the knife. So I will say कि पहला सवाल उनका या उन जैसे लोगों का पहला सवाल ये भी होता है कि क्या एज एक डिसाइडिंग फैक्टर है सर्जरी, लंग कैंसर की सर्जरी के लिए. I will say no, age is not a deciding factor, because at any point of time in your life, you do deserve a cancer-free life and a cancer-free survival, and hence I will recommend that age is definitely not a the primary deciding factor for to undergo the surgery. Yes, अब बहुत सारे मिथ्स है. सो सडन बहुत काफ़ी लोग ये भी पूछते हैं कि व्हाई सडनली वी आर टॉकिंग अबाउट लंग कैंसर. Yes, we have to now. I think it is the right time to create, to generate the buzz and to start speaking about it. Because आप देख ही रहे हैं कि smoking is very common and it is increasing. We are becoming more and more Western. So the smoking is increasing in all forms, in any forms and in all forms. Lung cancer के लिए सबसे पहला risk factor है smoking, and secondly is pollution, indoor or outdoor. And with the more and more urban life we are living, even the pollution is increasing, and it is only going to increase. So there are research, the international and ICMR, so even a national research, it suggests there will be 7 times rise in lung cancer by the time we reach 2025. So, and if we believe that this is going to happen, then we have to start acting upon it, and this is probably the right time. So yeah, I think we have come up, addressing this issue. This is a very important issue, and it also and addressing, the awareness. So we creating the awareness about this issue in our region and in our general population. We've also come up with a lung cancer screening program. It's a fun of its kind program which we've started in central India, and with the KIMS, and with the only institute which is doing it, taking the initiative to do it is KIMS group of hospitals. Yes, so we have to wait and see how much we deliver with this initiative and down the line in the next 2 to 3 months. But this is what we this is the first most important step we've taken to address this issue. Yes, I think I would like to now invite certain some audiences to ask some questions. एक very curious, but yeah, I mean, neglected, probably, it's a neglected area, but yes, some people have also, said that, lung cancer presents very late in India. Everybody, to be honest, मैं जहाँ जहाँ गई, मैंने जितने भी clinicians say I've had this conversation, everybody said, lung cancer presents very late in India, and then I have to be targeted. There have to be specific reasons about it. We had dig deep down on that issue, and then literature research and all of that, they do suggest, yes, it is presenting very late, क्योंकि बहुत सारे जो cancer looking या suspicious nodules होते हैं, है ना, lung में, they are initially treated with TB. They're considered as TB. They are put on, without, sometimes without even diagnosis, they are put on empirical TB treatment. So that is one, one major drawback, or one major flaw we have in the Indian healthcare system. Second, because not every nodule can be considered, or not every nodule in the lung should be considered as tuberculosis. Secondly, yes, somehow the referral system is very delayed. It has been a delayed referral system. I think it's observed overall in the country as a whole, and which also needs to be addressed. And thirdly, जैसे हमने कहा भी है कि poor screening हमारा screening in the healthcare is not there, and to target that issue, we have already taken an initiative. So yeah. मुझे किसी ने पूछा था कि lung cancer remains silent. So I will say, yes, unfortunately, क्योंकि लेट प्रेजेंट होता है तो symptoms in lung cancer can really can remain silent, and symptoms आते ही तब है जब जब ट्यूमर थोड़ा फैल जाता है. फॉर एग्जांपल पेन इन द चेस्ट, और ब्लड, खांसी में खून गिरना, है ना, वेट लॉस. तो ये जो सारे सिम्टम्स है, अनफॉर्चुनेटली वेल मोस्ट ऑफ दीज सिम्टम्स जो है ये थोड़ा लेट प्रेजेंट करते हैं, एंड दैट इज व्हेन it is when the tumor has already advanced. So again, that brings us back to why we should have a robust screening program in the country, and this is probably the right time to take a step towards it, and start with this screening actively. आई थिंक क्योंकि हम सर्जरी और लंग कैंसर की बात कर रहे हैं, तो आई थिंक आई वुड लाइक टू मेंशन complications related to lung cancer surgery. uh, like I said, keyhole surgeries जो है, minimally invasive या keyhole surgeries, so इसके complications, they are very less. Well, they are there. Any surgery has its own set of complications, which I would like to enlist, even though they are in the rates of 1 in 100 or 1 to 2 in 100. जैसे इन्फेक्शन, हल्का इन्फेक्शन इन द वुंड है, निमोनिया है, थोड़ा ब्लीडिंग चांसेस, little bit of pain, but that too in the post-operative period for next, for a few days, but then it's not something that cannot be addressed. So these are very less chances. Well, there are less rates, the lesser complication rates of about like 1 to 2 in 100. Risk to life is there, just like in any other surgery. There are risk to life associated with this surgery as well, of about, again, we'll say 1 to 2 in 100. एंड एनेस्थेटिक कॉम्प्लिकेशंस, जैसे कोई भी अदर दूसरे ऑपरेशन में एनेस्थेटिक कॉम्प्लिकेशंस होने के चांसेस होते हैं, वैसे ही इसमें भी होते हैं. या सो आई वुड से ओवरऑल ये उसका बेनिफिट ही है की होल सर्जरी फॉर लंग कैंसर एंड इन अर्ली स्टेजेस. ये उनका बेनिफिट्स है बेसिकली, बिकॉज दैट द कॉम्प्लिकेशन रेट आर क्वाइट लेस, even though they are not absent. सो डिपेंडिंग अपॉन द क्लियरेंस, जैसे जैसे से हम स्टेज बढ़ता है कैंसर का, है ना, तो डिटेक्शन का, सर्जरी इज ऑफ कोर्स, लाइक आई सेड, कि सर्जरी इज द फर्स्ट ऑप्शन, आई विल से, इन दीज काइंड ऑफ सिलेक्टेड ऑपरेबल पेशेंट्स. बट डिपेंडिंग अपॉन कितना क्लियरेंस है, कितने नोड्स हैं, अकॉर्डिंगली सम पेशेंट्स दे कैन रिक्वायर सर्जरी के बाद कीमोथेरेपी या रेडिएशन थेरेपी का उनको ज़रूरत पड़ सकता है to get to remain or to gain complete cancer free status. Agar so I will recommend, I will say, like from stage 1 to stage 3, these are, this is considered as the operable stage of the lung cancer. If chosen appropriately, surgery, मतलब operation कीमो के साथ या उसके बिना, है ना, तो it gives a 5-year survival rate of about like 40 to 85%, which can also extend to up to 90%. Stage wise, मतलब सर्जरी हो जाने के बाद और पूरा ट्रीटमेंट होने के बाद, at least there are chances that these patients, there are 40 to 85 or 87% chances that these patients are going to remain alive and cancer free alive. They'll be remaining cancer free alive at least 5 years after the surgery. Yes, which is a very yes, I think it is a very good it has a good survival rate and a good prognosis. Yeah, I think Mr. Belwani has asked one question. What are the treatment options for lung cancer? And what are the chances of good outcome of this treatment? Yes. I will, जैसे मैंने बताया है कि जो depending upon this presentation of the stage of the tumor, surgery, chemotherapy, radiation therapy, and a chemo plus minus immunotherapy and radiation therapy. There are three treatment options, I will say. तो या तो स्टेज वाइज अगर आप ले तो सर्जरी आई विल स्टिल से दैट द क्योरेटिव विल बी सर्जरी and it can be a sandwich therapy also as well, where there are certain advanced or less advanced cancers which can need an option, all the three combined together at for some form. Like I said, curative form, I think curative um, uh, treatment or the curative treatment option will be surgery. और उसका मैंने बता ही दिया है कि अगर सही से चुनाव किया है मरीजों का, so 40 to 85% है 5 year survival, which is a very very good survival rate. It has a very good outcome. What ongoing monitoring or follow-up care is necessary for patients who have undergone lung cancer surgery? Yes, it's an actually excellent question by Ms. Kumari. सर्जरी के बाद में so there is a set there is a protocol basically कि पहले 2 साल का follow-up is different and followed by next 3 years. At least these patients need in between frequent interval scans and the total follow-up or under supervision of supervised follow-up of at least 5 years after the surgery to label them as cancer free. और मतलब कि सर्जरी हो जाने के बाद अगले 5 साल तक हमें इनको मॉनिटर करना जरूरी है इंटरवल स्कैन्स, है ना, एंड क्लिनिकल असेसमेंट के साथ में, so that we can give them a full cancer, a 5-year cancer free status. Yes. Can you share success stories or notable cases where surgery played a crucial role in lung cancer treatment? Yes, of course. So we had a patient who was 54 years old and, with comorbidities. So he was a COPD and diabetic hypertension, and he had an early stage lung cancer. And we did a keyhole, मतलब की उसका so keyhole thoracic surgery, है ना, और उसका जो उनका जो बायोप्सी प्रूवन लंग कैंसर था, उनको हमने की होल प्रोसीजर से रिमूव किया. And I think this was done this was done last year, of course not in this hospital, but it was done last year. And this patient of course is under close follow-up and monitoring, like I said. But he's been doing quite well. He was a bit, he was somewhat a high risk case, but still, you can see, appropriate selection of the patient can give rise to successful outcomes, which is what we require. Okay, Mr. Vijay Meena has asked, can we live on single lung if one side lung is removed? Yes, we can definitely live on single lung. We can definitely live on single lung. There are, so देखिए ऐसे बहुत सारे बहुत advanced situations हैं, which may or may not be cancer. In India, these kind of situations are not rare. जहाँ disease काफी हद तक फैला है, एंड जिसको हम कहते हैं कि पूरा लंग निकालना पड़ सकता है, जिसको हम कहते हैं निमोनेक्टमी, इन आवर टर्म्स. तो यस, वो उसके बावजूद पेशेंट कैन लिव ऑन जस्ट वन लंग. Okay, again, he has asked another question, and that is during ICD procedure, if lung is punctured, then patient survives or not. So, well, of course, if lung is punctured, then patient, it depends. If there is a associated vascular injury, then the patient is going to have a lot of bloody discharge from the chest drain. But and I have never seen an ICD procedure which is puncturing a lung, leading to death of the patient on the spot. So I will say the answer to this question is no. The patient cannot, we cannot lose the patient just because it has punctured the lung. So the beauty of the lung is it will give you a lot of air leaks, but sudden mortality of any lung injury, it's very difficult to have a sudden mortality or a sudden death. That's the beauty of lung. What are the risks and side effects with the treatments you suggest? जैसा कि मैंने पहले भी कहा है, सर्जरी के मतलब risk and complications is what I'm understanding, that he's asked. Risks are to undergo, the risk to life, which is there with any other surgery. It's in the rate of about like 1 to 2 out of 100, and that is applicable to any surgeries. Complications with keyhole surgeries, they are less. जैसा मैंने कहा है, they are generalized complications. um, जैसे wound infection है, थोड़ा long stay because of other causes, or some amount of post-operative pain, which is again expected, and but it is very easy to tackle with adequate analgesia protocol. Um, yeah, I think these are the common complications. A little bit of bleeding, which we explain to every patient. अगर हमने पेशेंट को सही से और या सही टाइम पे मोबिलाइज नहीं किया, तो डीवीटी, heart rhythm disturbances, arrhythmias. So uh, these are common spectrum of complications, but they are not but they're not so commonly observed. I will say that 100 में से एक या दो लोगों को इनमें से कोई भी कॉम्प्लिकेशंस हो सकते हैं, जो हम हमारे सारे मरीजों को समझाते हैं when they present to us in the clinic. Again, the same person has asked one question, and that is, can we provide radiation therapy to lung cancer patient because due to radiation skin condition not that much good? So I think I will say, well, I'm not a radiation oncologist, and I'm not an expert in it, but I would say it doesn't seem to be an absolute contraindication. तो हाँ, अगर lung cancer advanced है और उस time या उस presentation के दौरान उसका appropriate treatment अगर radiation therapy होगा, तो yes, it can be, it can be chosen as a treatment modality for advanced stages of lung cancer. I will not say that skin conditions will be an absolute contraindication. So I think Mr. Ali has asked one question, and that is, what advancements or innovations in thoracic surgery have positively impacted lung cancer outcomes? Yes, correct. So innovations in thoracic surgery, advancements. So I think there are two subset of questions on this. Other one is the innovation in thoracic surgery. Keyhole, जैसे मैंने कहा है, keyhole thoracic surgery, है ना? ये अपने आप में एक innovative change हुआ है thoracic surgery में. Yeah, pehle 4 to 5 keyholes were, 4 to 5 holes were made of like 0.5, 5 millimeters या 0.5 centimeters के, और उससे lung tumor निकाला जाता था, and then slowly it has been shifted to a 2 centimeter incision, and just one single hole, and the entire surgery is happening with it. All right. So this itself is an innovation, an advancement, and it has improved लंग कैंसर आउटकम्स, क्योंकि इससे हम अर्ली स्टेज जो बहुत छोटे जो गांठें होती है, बहुत छोटी गठाने, पर फिर भी स्कैन में जो कैंसर की तरह दिखने वाली गठाने होती है, उसमें स्पेसिफिक कैंसर के चेंजेस स्कैन में दिखते हैं. So with single port, you can palpate them, you can see them, you can visualize them properly. एंड उसको अच्छे से हम लोकलाइज भी कर सकते हैं एंड रिमूव भी कर सकते हैं अगेन सो I'll say कि positively it has impacted lung cancer outcomes in the form of making it more feasible to remove for the surgeon by single port single by single incision I'll say or a single port um, uh, thoracic surgery. So yes, and like I said, because it is minimally invasive, so it is very easy to pick up all the early stages lung cancers. What advice do you give to patients regarding lifestyle modifications and preventive measures after lung cancer surgery? I think it's a very good question. Probably I should have, said it during my talk. So follow up, like I said, agar keyhole surgery, because I'll be talking more about keyhole. So yeah, so keyhole surgery does not involve too many lifestyle modifications. There is not बहुत ज़्यादा रेस्ट्रिक्शन नहीं है, बहुत ज़्यादा लाइफस्टाइल मॉडिफिकेशन की ज़रूरत नहीं होती है कीहोल सर्जरी के बाद. जैसे ड्राइविंग रेस्ट्रिक्शन नहीं है ना, ट्रैवलिंग रेस्ट्रिक्शन नहीं है. अगर लंग कैंसर की सर्जरी है, so there is you can have an air flight, you can have an air travel in like 2 weeks. 2 weeks के बाद you can choose your driving and all. I would just say but having said that, मैं अपने patients को कहती हूँ to avoid strenuous or heavy exercises, weightlifting exercises, या फिर heavy activities like diving, swimming for at least 6 weeks after keyhole surgeries. But otherwise, there are no other lifestyle modifications required. Um, uh, one thing that that is probably on the first day of the visit to me, that what I say is quit smoking, which is which is the only rational way forward. तो मैं अपने सारे मरीजों को एक चीज जो हमेशा कहती हूँ कि that they should stop smoking from now onwards as soon as they visit to me in the clinic. There are no preventive measures after lung cancer surgeries. Like I said, there are not too many restrictions. Again, there's another question, and that is, can you explain the role of a thoracic surgeon in the multidisciplinary approach to lung cancer treatment? Yes. So thoracic surgeon surgeon ka responsibility is as equal as an oncologist, a medical oncologist, a radiation oncologist, and a pulmonologist. So a multidisciplinary approach is the probably I think I would say it's the first it's the first requirement to treat any kind of cancers. Why just lung cancers? And it is the first step forward. And thoracic surgeon का उतना ही responsibility है जितना कि एक oncologist का है, जितना कि एक radiation oncologist का है, जितना कि एक pulmonologist का है, जितना कि एक physician का है, और जितना कि एक pathologist का है. So this whole thing, I think it's a teamwork. Giving an appropriate treatment to a lung cancer patient, it's mostly a teamwork. It's not a one man. It should not be a one man's job. What would the options be if the treatment does not work or if the cancer relapses after treatment? Yeah, again, a very good question. Yes, recurrence. Well, recurrence is not uncommon, है ना? And for that to tackle with the recurrence, I will say recurrence कहाँ पे हुआ है ना? उसके ऊपर भी डिपेंड करता है, बट स्टिल आई विल से कि हम यहाँ पर हमें कीमोथेरेपी, इम्यूनोथेरेपी, रेडिएशन थेरेपी, इनका हेल्प लेना इनकी हेल्प की ज़रूरत पड़ती है. So these are appropriate modality of treatments for relapses and recurrence of lung cancer. रिकरेंस ना हो इसके लिए हम वी मेक श्योर कि हम इनका स्ट्रिक्ट फॉलो अप एंड मॉनिटरिंग करें एटलीस्ट 5 साल तक सर्जरी के बाद. There's another question, and that is, what factors determine whether a patient is a good candidate for surgery in lung cancer cases? Okay, yeah, a good question. I will say stage of the patient, मतलब स्टेज ऑफ द कैंसर, किस स्टेज पर कैंसर डिटेक्ट हुआ है ना, विच टाइप ऑफ कैंसर इट इज. फिर उसके अंडरलाइन जो फेफड़ों के पंपिंग जो फेफड़ों की जो क्षमता है, उसके रिजल्ट्स क्या है ना? एंड अंडरलाइंग पेशेंट्स को मल्टीपल द रिस्क फैक्टर्स तो नहीं है, जैसे कि अगर पेशेंट का रिसेंटली एंजियोप्लास्टी हुआ है, रिसेंटली बाईपास हुआ है, दीज आर काइंड ऑफ वेरी हाई रिस्क कैंडिडेट्स, एंड वेयर unfortunately lung cancer surgeries can be might need to be put either on hold or look for alternative treatment options. These are primary, and हाँ, the most important is patient का खुद का performance कितना है. So performance score, the most important thing which we look for any kind of a cancer surgery is what is the performance score of the patient, and this is also one of the prime deciding decision making modality if he is going to be a good candidate or not. Miss Vidya has said, my friend's mom is suffering from CA lungs. As per doctor, nothing can be done as they came to know very late. What can be said to them to do for the patient? Yeah, I think it's a very, very common question, very common presentation of lung cancers in India, especially. Like I said, late presentation because we sit, we have a tendency to sit and for the symptoms to appear. Unfortunately isme I will say ki probably it's a late presentation of lung cancer and a late detection. uh, I will say कि अगर biopsy इनका positive है, तो we can try for the other modalities of treatment, जैसे कि कीमोथेरेपी है, रेडिएशन थेरेपी है, इनका हम हेल्प ले सकते हैं. Yes, yes. So she had a presentation with cough only. Yeah. So I will say कि cough. Don't it's no more a symptom which needs to be which should be neglected. uh, that's what I'm going to say. Cough, जो भी long term cough है ना, इसको neglect इसलिए नहीं करना चाहिए because it can be a silent marker or it can be a subtle marker of anything, of an underlying, even a cancer. Not just not just a TB or allergic cough. It can be a silent marker of a cancer as well. So we have to be vigilant कि कॉफ बहुत लंबे समय से तो नहीं है ना, मेडिसिन से ट्रीट नहीं हो रहा है. सो बहुत लंबे समय से मेडिसिन से ट्रीट नहीं हो रहा है ना. अगर एक्सरे, चेस्ट एक्सरे में कुछ शैडो आया है, या रीसेंट वेट लॉस है, या बैक पेन, बोनी पेन है, या रिप पेन है, या चेंज इन वॉइस है, तो ये सब अगर है, सिर्फ कॉफ अकेला है, बट अगर लंबे समय से है, मेडिसिन से ठीक नहीं हो रहा है, तो उसे नजरअंदाज नहीं किया जाना चाहिए. या फिर कॉफ विथ ऑल दीज अदर सिम्टम्स in any form. So again, it is an alarming presentation. Yeah, it should be addressed accordingly, and I would say strictly, to be honest. Is there any lung cancer screening investigations, or is there any package related to it? If yes, what all investigations a person have to go through? Yes, so like I said, मैंने पहले भी बोला था मेरी talk में कि to address poor screening issues, which is again one of the most important issue why these patients are presenting so late. हमने एक lung cancer screening program start किया है, और इसके अंतर्गत हमने स्पेसिफिक जो कैंडिडेट्स हैं उनको very selected and specific candidates, or which we call as a high risk candidates, उनके लिए हमने एक लंग कैंसर स्क्रीनिंग पैकेज start किया है, which includes the most important in this package is the low dose CT scan. Low dose CT scan, and which we have supplemented it, or we have added a lung function test with it, ताकि अंदर जो भी कुछ in high risk candidates में, which is anything which is subclinical or hidden, वो भी डिटेक्ट होगा, है ना. And then an consultation with an expert thoracic surgeon. So yes, we do have a lung cancer screening package, and but this should be well, there is a Google form link, which will be at the end of this talk. It will be attached. I think there are some coupons as well, which will be attached at the end of this talk, so that कि जो भी हाई रिस्क पेशेंट्स हैं, या जो भी आपके आसपास आपको लगता है कि दे आर probably good candidates, such candidates should take, इसका फायदा उठाना चाहिए actually in targeted candidates ने इस पैकेज का. Thank you so much. Thank you. Thank you. Do we have to maintain any diet, particularly after surgery? Uh, no, there is no dietary restriction. That is the beauty of any keyhole surgery. There is no dietary restriction. But like I said, key smoking, we should quit smoking as soon as it is detected. Number one, irrespective of whatever treatment you take. But I think you should quit smoking as soon as it is detected. So yeah, I think that is the only restriction, to be very honest. Thank you. Thank you so much.